Hello students, welcome to another session of e-learning in Panchkarm, and today we will be continuing with the physiotherapy from where we left off in the previous lecture. First we will study electrotherapy, in which electrical current is used to give therapies. In electrotherapy, the treatment is given with the help of electrophysical modalities, which may include low, medium, or high frequency currents, and such treatments are termed as electrotherapy. It can be of two types, that is actinotherapy and heliotherapy. In this kind of therapies, various radiations and electromagnetic fields are used for giving the therapeutic effect. Out of the two types of electrotherapy, first is actinotherapy. The term actinotherapy is derived from a Greek word that is actis, which means a ray, and actinotherapy means a treatment by using rays, especially from artificial sources, for example a lamp. The second type of electrotherapy is heliotherapy. The treatment by using the rays from natural sources, that is sun, is known as heliotherapy, and the only difference between two modalities is how the rays are obtained. In one, artificial sources are used, and in the other, natural sources are used. Before going further into the therapies and its details, we must first understand the electromagnetic spectrum. There are different forms of waves which are recorded, and they are radio waves, infrared rays, visible light, ultraviolet rays, X-rays and gamma rays. There are different wavelengths of all of these. The radio waves have a wavelength between 0.1 mm to 100 kilometers. The infrared rays have a wavelength from 750 nm to 0.4 mm. The visible light spectrum is between 400 nm to 750 nm. Ultraviolet rays are between 10 nm to 400 nm, and the X-rays are having a wavelength from between 0.01 pm to 100 nm. Infrared therapy, as the name suggests, is a therapy in which infrared wave or rays are used to give therapy. Infrared rays were first discovered by a German scientist named as Sir William Herschel in year 1800. Infrared waves or rays are electromagnetic waves with a wavelength of 750 nm to 40,000 nm and a frequency of 4 by 104 and 7.5 by 101 Hz. They lie beyond the red boundary of the visible spectrum of light. It is said that any hot body can produce infrared rays like the sun, electrical bulb, coal fire, gas fire, or even human body. Sun is the natural source of infrared radiations. There are different categories of infrared rays categorized into near infrared rays with 0.76 to 1.56 microns, mid infrared rays having wavelength 1.5 to 4 microns, and far infrared rays between 4 to 1000 microns. It is said that far infrared rays are the light of life, as they promote healing in body like no other. In physiotherapy, infrared rays are produced by two types of generators. One is non-luminous generators, produce only infrared rays. The other is luminous generator, which produce infrared, UV and visible rays. First, amongst the two types of generator, we will study non-luminous generator. It consists of a coil wound on a cylinder of insulating material, for example porcelain. In this, an electrical current is passed through the wire, which results in the production of heat. This heat produces infrared rays which are transmitted through the porcelain. But this porcelain gets heated and generates the radiation, which includes visible rays. This coil is embedded in fire clay or placed behind a fire clay. Therefore, the emission of rays occurs from the fire clay, which is commonly painted black, and thus very few visible rays can be produced or emitted. This kind of generator is normally useful in acute inflammation or cases of recent injury. The second category of generator for production of infrared rays are luminous generators. They are in the form of incandescent lamps or bulbs. In these lamps, we are having tungsten filaments and are filled with inert gas at low pressure. Upon passing current, they produce visible light, infrared rays as well as other rays. They are useful in diseases or lesions which are chronic in nature. This is the commonly used infrared generator which is easily available. The area or depth of effect of both these generators differ. The non-luminous generator produce rays which can penetrate up to superficial dermis and have a wavelength between 750 to 15,000 nanometer. On the other hand, luminous generator can penetrate up to dermis and epidermis, and it has wavelength between 350 to 4000 nm. The procedure of performing infrared therapy is quite simple. At first, the patient is prepared by removing the cloth from the affected part, and the sensation to cold and heat is tested on the skin to perform or prevent any kind of damage. Patient should be cautioned about the risk of uncomfortable warmth and that it should be reported immediately to avoid any kind of burn. Patient should also be advised to prevent any undue movement during the therapy so that maximum results can be achieved. The lamp shall be positioned about 50 to 25 cm away according to the perception of heat from the skin of the patient, and arranged in a way that the radiation falls on the skin of the patient at an angle of 90 degrees. Next, most commonly used treatment in electrotherapy is shortwave diathermy. Diathermy is a Greek word which means through heating. SWD or shortwave diathermy consists of high frequency electromagnetic waves having frequency between 107 to 108 Hz and wavelength between 30 and 3 meter to generate the heat in the body tissues. It provides the deepest form of the heat available through the physiotherapy. Therapeutically used frequencies and wavelengths are 27.12 MHz and 11 meter. The high frequency current being used in SWD provides impulses with duration of 0.001 millisecond, which is beyond the range of nerve stimulation. Therefore, there is no discomfort and no muscle contraction is produced, making it a safe treatment. There are two methods of application of SWD, one capacitor field method and the other is cable method. In capacitor field method, electrodes and patient's tissue form a capacitor. The electrodes are placed on either side of the affected part and are separated from the skin of the patient by insulated material, and the current is passed, which makes it a capacitor. In the cable method, a thick and insulated cable is used for the treatment purpose, and the cable is coiled around the patient's body, separated from the skin by a layer of insulating material. The effect of the electric field or magnetic field on both is used in this type of diathermy. Indications of SWD include inflammation of joints, degeneration of the joints of neck, knee, and hip, etc., ligament sprains and strains of muscles, low backache, plantar fasciitis or heel pain, muscle and tendon tear, and hematoma. Whereas contraindications include high fever, fluctuating blood pressure, persons having untreated epileptic or fits, persons using cardiac pacemaker, having kidney and heart problem, pregnant ladies, and patients with tuberculosis of bone. The treatment time of SWD depends upon the stage of the disease. In initial states, 5 to 10 minutes of therapy per day is sufficient. In moderate stage, 10 to 20 minutes of treatment is sufficient, and in severe state of disease, 20 to 30 minutes of treatment is required. Care in both the treatments should be taken to caution the patient and be alert to avoid any kind of shocks and burns to the patient. With this, we come towards the conclusion of today's session, and in next session we will continue with further treatments and other modes of physiotherapy. Thank you.